Okay, good evening, everyone, and welcome to one and all. As you all know, OCI has four special interest groups on Facebook. We have binocular vision, dispensing optics, low vision, and clinical optometry special interest groups. So month we hold one webinar for each group, and this time we are holding it for our binocular vision group members and optometrist locator practitioners. So, as we all know, vision therapy is a program which aims to improve a person's visual abilities, and it uses a variety of ways. It can help promote visual efficiency and strengthen various aspects of your vision, which goes beyond actually eye muscle strengthening and orthoptics. So the aim of vision therapy is to optimize the eye-brain connection, visual skills, and visual perception. So today we have Ms. Zeba from CureSee, and she is going to talk on enhancing vision therapy using artificial intelligence. Ms. Zeba has graduated from Jamia Hamdard in 2020. She is pursuing her master's from Chitkara University, Ludhiana. She is currently working with CureSee as a vision therapy consultant and business development optometrist. So without wasting much time, I would like to invite Ms. Zeba to give her talk. Welcome, Zeba. Over to you.
Hello. Thank you so much, ma'am. Thank you for giving me the opportunity to present on OCI platform. So good evening, everybody. I am optometrist Zeba, and today we will be discussing about how CureSee is treating amblyopia. We'll be going through the presentation, what all the sciences that we are using, and then we can see the practitioner and the patient demo of the software as well. So as you all know, CureSee is world's first artificial intelligence-based vision therapy software, and we aim to improve visual acuity of patients having amblyopia of all the age groups. So age is not a barrier when we are talking about vision therapy in amblyopic patients. CureSee is all the modules in CureSee are FDA approved. And what is the science behind CureSee vision therapy program? So we are using random dot stereogram as a therapeutic module. We are using dichoptic principles. That is, we are using two colors, the red and blue color, and both the colors are contrast adjusted. Then we have exercises for crowding phenomena, exercises for anti-suppression technology. Then we are using combination of monocular and binocular exercise. So we are not just limiting the exercises to binocular form or just patching. We are giving a combination of both. Then we have individualized and customized contrast threshold. So what's exclusive when we talk about CureSee vision therapy? So we have artificial intelligence. The whole idea behind artificial intelligence is to reduce the chair time of the practitioner, right? And all the exercises based on the performance of the patient, the exercise can automatically keep changing. And in the lifetime, we can also change the difficulty levels, right? Then we have Gable patch exercise to improve the contrast sensitivity of the patient. Research was conducted in Ahuja Eye and Dental Institute, where the pool size of the patient was 68. And we have seen that within 6 months of span, patients improved to 0.6 log mark. This is how the patient panel looks like. It has different exercises. Exercises are there for crowding phenomena, exercises there for saccades, pursuits, for convergence, and for divergence. Just a small demo of how different exercises are there. So just yeah. So when we are talking about dichoptic, we are using red and blue color, and the colors are contrast adjusted. So what we are doing is we are decreasing the contrast of the better eye to a level where it matches the contrast of the amblyopic eye. Okay. Then we just update it, and all the exercises are set in that particular contrast. Right? So every day, patient gets 6 exercises, and those exercises keep changing based on the performance of the patient. So after setting the contrast, for example, in this exercise, you will see that both red and blue color will start appearing on the screen. So it is a binocular field, but here the patient is fixating monocularly. They can only see red color with the red filter and blue color with the blue filter, right? All the exercises runs for 5 minutes, and after 5 minutes, the exercise automatically stops, and the result of those exercises are uploaded in the patient panel and practitioner panel. So what is there in the patient panel? We have dashboard where all the exercises are there. We have live report of all the exercises so that we can keep a tab on how the patient is performing each day. And when the patient is coming for follow-up, we have the entire data of from the day when the therapy was started. Then we have the option to set the contrast where we can adjust the contrast of both the eyes. FAQ is there to clear the basic doubts that the patient might have. Now, if the patient is coming from a remote area or from any area where there is no internet access or the internet access is not that good, we have the option to download the exercise and they can do it in offline mode as well. Then we have customer support so that if any issue is there for the patient or for practitioner, we can resolve that ASAP. Right? Now, this is how the practitioner panel looks like. You will have the list of all the patients that you have added and the reports of all the patients, how they are performing the exercise. Right? So on the dashboard, you can get the list of all the patients that you have added, whether they are active or they have completed the therapy. All the details are there on the dashboard. Then again, you have live exercise report of each and every patient from the day they starts till the exercise lasts. For example, if it is a 3 months plan, from the day you are starting the exercise to the day it lasts, you will have exercise reports for each and every day and overall graph of how the patient has performed. Right? The billing process and everything is very easy. Everything is online. Then basic FAQs are there. You have complete control of all your patients, whether you want to pause the therapy in between, whether you want to activate, whether you want to give it for 1 month or 3 months or 6 months, or whether you want to give convergence exercise along with that. So you have that complete control of your patients. Then again, customer support is there to resolve any query or any issue that might come up. Okay, this is how, just a small video. So this is what I was talking about. You can have a complete report of all the patients from the day they start the exercise till the end. So every day you see every box is representing a date. For example, this, if I click, you can see all the exercises and the score of those exercises on that particular day. And this is the overall graph, which shows how the patient is performing. This is a video just to tell how to add a patient on the software.
How to add a patient. Log into your doctor's account. Click on Add New Patient. Fill in all the basic details that are appearing here on the screen. You can create or
You just
generate
have to write
password.
email ID, date of birth, and phone number of the patient. You can generate any password, whether you can
Once you have
keep a
generated the
standard password
password,
for all the
click
patients,
on
or you
Add
can
Patient. Then you will be redirected to license page where you can select the buy 6 months package plan, add anaglyph, fill in the basic address details, pay and continue.
whenever you are adding the patients, all the patients are getting free trial sessions so that we can give one demo to the patient at the clinic, and then if they're still not convinced, or whether any patient wants to go home and try whether they are able to do the exercise, they can go home and do the exercise for another 3 days and then make a decision. Right? We'll be coming to all this once again. These are few of the hospitals which are there. So we have a group of 30 plus ophthalmologists and optometrists who are there as mentors for us and with whom we are working and giving vision therapy to patients. These are few of the testimonials. So he is a 40-year-old patient.
Hello, good morning. आपका नाम
Hello
क्या है?
everyone, my name is Manish and his name is Samshad. He is 9-year-old
My name is Sachin and I
and
am
he is
40
from
years old
Udayan Care NGO.
and we based out of Hyderabad. I
मेरा
came
नाम
to know
दीक्षा
about
ठाकुर है।
CureSee from.
पहले मुझे देखने में बहुत प्रॉब्लम आती थी, फिर मैं डॉक्टर के
My
पास
name is
आई
Sachin
चेकअप
and I am
करवा
40 years old and based out of Hyderabad. I came to know about CureSee from a friend whose daughter is also going through a similar therapy with CureSee. And I have this lazy eye issue for last 20 years and I have seen so many doctors in different cities and everyone told me that nothing can be done about this at this age. But when I started my therapy with CureSee, my left eye vision was 6 by 18 and in just 4 months time the vision has improved from 6 by 18 to perfect 6 by 6 now. So I'm able to read till the last line now. And in during this period, whenever I went to see a local doctor, everyone was very surprised to see the progress I'm having because of the therapy. And the support team of CureSee was also amazing. Great support in responding quickly and arranging any follow-up sessions as required. Thank you, CureSee.
मेरा नाम शबाना है। मुझे पहले देखने में बहुत प्रॉब्लम आ रही थी, तो मैं डॉक्टर के पास आई चेकअप के लिए गई और वहाँ मुझे मेरा विज़न पता चला 6/12 था और मेरी लेजी आई थी और वहाँ डॉक्टर ने मुझे CureSee विज़न थेरेपी के बारे में बताया। अब 5 मंथ हो गए हैं, मुझे बिल्कुल सही दिखाई दे रहा है।
अभी कहाँ से आए हैं? हेलो, गुड मॉर्निंग। आपका नाम क्या है?
शिवानी।
अच्छा, आप अभी कहाँ से आए हैं?
गुड़गांव से।
अच्छा, तो पहले आपकी नज़र कितनी थी?
6/36। एक आँख में दिक्कत थी और दूसरी आँख में राइट साइड में 6/6 है। लेफ्ट साइड में दिक्कत है।
तो अभी आप क्या करते हैं? स्कूल जाते हैं?
दीवानी में बॉक्सिंग करते हैं, वहाँ पे स्कूल में पढ़ती हूँ।
अच्छा, तो इससे पहले आपने कहीं पे दिखाया था?
दिखाया था, फिर वहाँ पे इतना रिजल्ट नहीं आया अच्छे से, तो फिर यहाँ पर ट्राई किया। यहाँ पे पहले से बहुत अच्छा है।
बॉक्सिंग में आपने कुछ देखा, कुछ फर्क आया हो? पहले बॉक्सिंग करते टाइम कुछ परेशानी आती हो या कुछ और करते टाइम नज़र की वजह से कुछ
होता था, क्योंकि इस आँख की वजह से थोड़ा बहुत धुंधला वगैरह दिखाई देता था, तो बॉक्स प्रैक्टिस करने में बहुत दिक्कत होती थी। तो पहले से भी प्रैक्टिस करने के बाद यहाँ पे आने के बाद एक्सरसाइज करने के बाद अच्छा लगा। ऐसा पहले से बहुत फर्क है इसमें।
तो अभी आप कौन सी थेरेपी यूज करते हैं?
CureSee है।
आप अपने घर पर ही कर लेते हैं या फिर बाहर?
घर पे
The state level boxing.
अच्छा, तो रोज कितना टाइम लगभग आप थेरेपी में लगाते हैं?
She is also great for national.
पहले से भी जैसे आज आपने आई टेस्ट कराया, तो अभी आपकी कितने किलोमीटर है पहले से?
6/9।
6/9। तो पहले आपकी आपने कहा 6/36 से 6/9 तक। ठीक है, तो हम होप करते हैं कि आपको जल्दी 6/6 आप पहुँचे और हमारे देश का नाम रोशन करें बॉक्सिंग में। ओके, थैंक यू।
Hello everyone, my name is Manish and his name is Samshad. He is 9-year-old and he is from Udayan Care NGO which is in Narsinghpur, Gurgaon. पहले इसने जब इसका सर्जरी हुआ था, इसका विजन था 1/60, बट जब इसने विजन थेरेपी स्टार्ट किया CureSee से, तो इसका विजन विद इन 2 months 6/6 है एंड बहुत ज़्यादा इम्प्रूवमेंट देखने को मिल रहा है। थैंक यू।
मेरा नाम दीक्षा ठाकुर है। पहले मुझे देखने में बहुत प्रॉब्लम आती थी, फिर मैं डॉक्टर के पास आई चेकअप करवाने के लिए गई। वहाँ मुझे पता चला कि मेरा विज़न 6/36 है और मुझे लेजी आई हुआ है। फिर उन्होंने मुझे CureSee विज़न थेरेपी के बारे में बताया और मुझे 5 मंथ्स हो गए हैं और मुझे पहले से ज़्यादा बेटर दिखाई देता है।
These are few of the testimonials which are there. Then we come to a comparative analysis of various software which are there in the market and how CureSee is different from all the software. So what we are doing is we have complete AI integration. So all the exercises keep changing, as I told you earlier, based on the performance of the patient, so that the chair time of the practitioner is also reduced. You don't have to manually keep changing the difficulty levels or manually keep changing the exercises, right? Whereas in other software, in some of the software, there's only partial AI integration or no AI integration. Then we have the ability to run both offline and online based on the access to internet that the patient might have. Then we have Gaber patch module where we are trying to improve the contrast sensitivity of the patients. Right, by we are giving various contrast, varying contrast that helps in the visual system to perceive subtle differences in the contrast. Right. Then the number of sciences which are used is 8 in CureSee as compared to 2 in Binocs, 1 in Emblyoplay, and 2 in NovaSight. So we have exercise for crowding phenomena, we have exercises for saccades, we have exercises for pursuits. Then, as I told you earlier, there are 4 free demo sessions for every patient that you are adding, right? So one session we can give in the clinic, or the patient can come for 4 consecutive days and do the exercise in clinic. Or if they want, they can go home, try the exercise, right? And see how they are responding to the exercise. You have a dedicated 24/7 support team of CureSee. And then in best corrected visual acuity improvement for CureSee is 0.6. In Binocs, it is a presentation. I'm going to show you the demo of all the exercises which are there. One second. So this is how the software looks like, right? We have all the resources available online, so you can go and check out all the resources which are there. Then you have option to find clinic. So whenever any clinic is getting onboarded, what we are doing is we are mentioning that clinic on our website, so that if any patient who is looking for vision therapy for amblyopia in nearby your locality, they can just filter the location, and based on that they can visit their nearby clinics, right? Coming to the software, the moment you click on login, you have a patient panel and a practitioner panel. On the patient panel, all the exercises are there from where the patient has to log in and do the exercise. On the practitioner panel, you have the list of all the patients that you have added, right? So first, we'll just go through the patient panel once. The moment you click on login, you have to write the email ID and the password that we have created from the practitioner panel. And this is a demo account, so you have all the exercises here. But on the patient panel, there will be only 6 exercises. So in one day, there is a session for complete 1 hour where 25 minutes of binocular training is given to the patient, 25 minutes of monocular training is given to the patient, and 5 minutes of Gaber patch exercises there. So to be precise, it is not even 1 hour, it is 55 minutes of duration for every day, right? And step 1, which the patient has to do, is go to settings. They will be given these anaglyphs, which they have to put on over their own spectacles like this. Now, what you have to do is you have to set the contrast of these 2 circles to a minimum threshold level, right? So for example, if I'll just take it to 0 and slowly start increasing the contrast of both the circles to a level where I just start appreciating the colors. So for example, let's assume that my right eye is amblyopic. Okay, so I might appreciate the contrast of right eye somewhere, left eye somewhere here, right? And for right eye, I can appreciate the contrast here itself. So what we are doing is we are reducing the contrast of better eye and increasing the contrast of of amblyopic eye to a level where I can match the contrast of both my eyes, right? The moment we update, all the exercises are set in this particular contrast. For now, I'm keeping the contrast so that even if anybody has joined from their mobile phones, they can also see all the exercises clearly, right? After updating it, we'll just go back to dashboard. And on every exercise, you will see that there are two icons. On one side, there is red and blue glasses, and on the other side, there is a smiley with a patch. So we are giving monocular exercises to improve the monocular acuity and binocular exercise to improve all the binocular functions, right? So first we'll do all the exercises with red and blue glasses, and then we can do all the exercise with patch, and then we can complete the exercise with which is Geber patch, right? For example, if I start this exercise, all the patient has to do is shoot the balls which are coming on screen. Gamified, so adherence to exercise is better as compared to just patching, right? They just have to shoot these balls. It is a binocular field, but here fixation is monocular. That is, you can only see red with the red filter and blue with the blue filter. Right? Every exercise runs for 5 minutes. After 5 minutes, it automatically stops and it will have a green tick. That means you have completed that exercise for a day. And with every right response, what will happen is that this level of these exercises will keep on increasing. It will keep on getting more difficult. So we don't have to manually change. As soon as the performance, the scores improve to 80, 85, it will take you a level higher. If your performance is not good, if you're giving wrong responses, it will take you a level down. Now, the same exercise is there in monocular mode where you have to patch your better eye and do the exercise with emblyopic eye. Then we have exercise for crowding phenomena. Again, all the exercise will have instructions, so it will be easy for the patients to do the exercise, right? Now here, there's a crowd, and at the bottom it says search to. So the patient will put on the red and blue glasses, and all they have to do is search to in this crowd and tap on it. So once it will be red, and then it will be blue. So one eye is getting the stimulus, and then the other eye is getting the stimulus. Now it is saying search percentage. So there are total 3% in this crowd. So you have to tap, right? Again, with every right response, the size of these targets will keep getting smaller and the crowd will keep on increasing, right? Again, the exercise will run for 5 minutes and after 5 minutes, it will stop. Then that was on easier level. I'm just going to show you when the exercise gets difficult or when we are increasing the level, what is the maximum level you can get to. So now here, if you see, this is for pursuits, right? You have to follow the motion of the moving object, and at the same time, you have to type it on the keyboard. So whatever alphabet is floating on the screen, you have to type on the keyboard. If K is there, I'll type K. If D is there, I'll type D. If B is there, I'll type B. So you see that this size of this alphabet is so small and the speed is very fast. So it is on a difficult level. So we start from a very basic level where the alphabets are easily recognizable, even if the patient is at 6 by 60 or 3 by 60, and then we increase it to this level. Right. So here you are following the motion of the moving object. Both the eyes are getting the stimulus, and at the same time you are using your hand to type it on the keyboard. So your eye-hand coordination is also improving. This is for seconds. Here you see the level is comparatively easy, right? So again, whatever alphabet is there on the screen, you just have to type it on the keyboard. And both the responses have a different sound. So if you're giving a right response, it will have a different sound. If you're giving a wrong response, it will have a different sound. So let's say if the patient who is 15 years or 16 years of age, parent might not be sitting along with the patient to do the exercise all the time. So even if they are not sitting but they are around, so with the sound they can analyze whether their child is actually doing it right or not. Then we have doc chart. So here you have 4 alphabets are there. You just have to type it on the keyboard. Now, because if we keep giving the same exercise to the patients, it will become monotonous for the patient. So idea is to keep changing the exercise so that adherence is more and the patient is also interested to do the exercises. Right? For example, in this a little more gamified version, here also the patient is following the motion of the moving object, right? So what you have to do, from one side computer is playing and from the other side you have to use the up and down arrow key and make sure that this ball lands on this white disc which is there. Again, with every right response, it will keep on getting difficult. Then we have random obstacle. Here, what you have to do is you just have to press the space bar whenever the hurdle is coming, right? So these boxes will keep on coming. You just have to cross them using the space bar. It is similar to the exercise, the game which is there on Google Chrome when the internet is down. So both red and blue obstacles will keep on coming. Now, all the exercises are same in monocular mode as well. Right? Then we have raindrop, where these streaks of lines will keep on coming and you have to make sure that it passes through the gap in the white line. Again, if it touches the line, there will be a different sound. Then here you just have to draw the gap between the red and blue lines. Then we have Gabor patches. So here the patient, if you see here, there is no icon for red and blue glass or smiley is there. There's no smiley, right? There is just a play button. So this the patient has to do with their own spectacles, or right? They don't have to put on those red and blue glasses or any patch. So what they have to do is they have to align 3 similar contrast gratings, either horizontally or vertically. So it should be in a group of 3 or more, right? So for example, if you see these two are similar, right? So what I can do is I can find another one which is similar to these two and align it in one line. So I can just bring the similar one here and you'll see it will go and next pattern is going to come, right? Again, these two are similar, right? I can align another one and the next pattern is going to come, right? These two are similar. Can align and the next pattern is going to come. So all you have to do is align 3 similar contrast gratings. It can be in a group of 3 or more, either horizontally or vertically. You cannot align it diagonally. Then we have exercise for convergence and divergence as well. These are based on RDS module. What you have to do is you have to put on these glasses, and within this big square, you'll all see a small square which is there. When we put on these glasses, it looks like a holographic image which is floating somewhere inside the screen, right? It will look like a 3D image. All you have to do is tell the direction of the square using the arrow keys. So if it is upside, I'll use the up arrow key. If it is on the right side, I'll use the right arrow key. If it is on the left side, I'll use the left arrow key. So with each right response, the fixation disparity will keep on increasing. Again, you will have to converge more to see that image in 3D, right? Then we have exercise for divergence. So again, instead of floating somewhere inside the screen, it will look like it is popping out of the screen. Way to do the exercise is same. You have to tell the direction of the 3D image using the arrow key. So every day the patient gets 6 exercises. Every exercise runs for 5 minutes. 5 of those exercises are there in 2 modes. Once they will do it in with the anaglyphs, then they will do it with patch. One exercise is there only with their own spectacles or whatever prescription they have, right? So complete duration is 1 hour. Now sometimes if there is a small child who is just 5 or 6, they might not sit for an entire 1 hour, right? So what they can do is they can break the exercise into two, and they can do for 25 minutes in one go, and then for 30 minutes in another go. So if they can either give a 15-20 minutes break in between, or they can do it once in the morning and then in the evening, right? Then coming to practitioner panel. Just one second. Again, you will be asked to write your email ID and password. So this is how the practitioner panel looks like. You will have the details of all the patients that you have added, right? And here on the right side, you can see the graph which is showing it. It is telling you about the report of the patient. And then you have the option to edit. So from here, we can if we want to give convergence or divergence, we can give it, right? We can note the clinical findings of all the patients as well. I'll come to that later. First, we can just go through the patient panel, the reports, right? So if I take this, right? So the patient started doing the exercise from 3rd December. Now I can just click on 3rd December, and all the exercise that were done on 3rd December, they will come on the screen along with the scores, right? So we can keep a tab on the scores as well, how they are changing. So the idea is, even if the patient, let's say, starts from 40 score, they should keep on improving the score. So if today it is 40, the next day it should be 45, then it can go to 50, 60, 100, like that. It should not keep fluctuating. Let's say that I started doing the exercise today, my score is 80. If it goes down to 30 the next day in the same exercise, that means I'm not actually focusing on the exercise. There is probably another movie going on the television, so I know, I'm just watching the television and doing the exercise along with that. So you can keep a tab on score. It will tell you how the patient is doing the exercise, because opening the exercise and completing it for 5 minutes is another thing, right? They might do the open the exercise and keep it open for complete 55 minutes, but whether they are performing or not, that from the scores you can get the idea, right? So I know that the patient did not do the exercise for 4 days in between, right? If I go to see another patient's report, so this patient started doing the exercise from 17th August. So in between, if you see, he has only missed for probably 1 day in a week, or here he has missed for complete consecutively 4 days, right? So it will give you an entire report for the entire duration the patient is doing the exercise, right? And the overall report is there at the bottom of the screen, right? So whenever you are adding the patient, you have that option to note all the clinical findings of the patient as well. I'll just show you one of our patient's report. For example, in this patient, she first came to us on 8th September, right? So the vision on that day was 6/36. And then we can record every consecutive follow-up when she's coming. in 1 month she has gone to 624, then she has improved to 6 by 18. And now also we have recently done the follow-up, she has improved to 6 by 12 as well now, right? So that also we can mention. So we can keep a record of all the patients. So sometimes the patient is coming and they don't have the prescription, or we don't have the prescription, we have lost the record. So in the software itself, we have the entire data. So even if you want to do a research in the later stages, also you will have the data of all your patients, right? And whether if you want to, so by default, all the exercises are there only for amblyopia. What you can do is, if you want to give convergence exercise along with that, you can just add convergence or divergence and update. So along with that, convergence and divergence exercise will start coming. Right? So this is how the entire software works, right? If there are any questions, I'm happy to take it. Thank you, everybody.
Thank you so much, Zeba, for the wonderful talk, and it was very engrossing and lovely to see those success stories, I must say. There are few softwares available in the market for amblyopia and binocular vision anomalies, and CureSee definitely stands different and very unique in its own way, as you explained in your presentation. I just wanted to ask one question, that how do you check the compliance, especially those who are taking it offline?
Right. So for offline, everyday report is not getting uploaded. So what they have to do is, let's say the patient is doing in offline mode, they have in once in a week they can log in from the same system online, and they have the option to update report or upload report. So they just have to click on that button, and the entire report of those patients which is stored offline will be uploaded on the patient's practitioner panel, and they can have the access of all the reports.
Oh, okay. Thank you.
Yes.
Actually, we have a lot of questions in the chat box. Most of them have answered by Mr. Amit Sani. I can see that. There's one question. Can you just show us the demo on how to do the binocular vision assessments?
So we are actually working on our assessment diagnostic module, which is in beta stage. So it will have all the diagnostic module is there for saccades, pursuits, visual acuity, which is about to get launched in the month of March. So I think around March we will be in a better position to show you the diagnostic module.
Okay, thank you. We have Mr. Amit Sani today with us. He is a co-founder and CEO of CureSee. Welcome, Mr. Amit. Okay. We just want to know how the idea clicked, behind the invention of the CureSee, basically.
The idea was very basic. We would Puneet, my another co-founder, came and discussing with me that one of his friends' brother is suffering from amblyopia. So we just looked at and he was not a kid. He was, when they realized that he has amblyopia, he was a 22-year-old man, and we knew that block string and pencil push-up will not work in. So we thought, why not make something and something which is easy, and then we started working on you can say a SWOT analysis, because Puneet happens to be my room partner in IIM as well. So we had this flair that let's take out the problems first. What are the problems? Then we actually got into talking to a few of the ophthalms, pediatrics specifically, because we thought if it has to be done, it cannot be left to develop, and then after some age we start try to cure it. So we thought, why not end it as soon as it is identified? So we realized that in long term, these eye tests will be done at school level. It should be done because it is done abroad, so it will be implicated. So the best thing will be, as soon as it is identified, we can rework it, because if you see the researches which is done by AIMS on CureSee, they had maximum recovery when the age group is, I would say, between 5 to 12. And as we start aging, as in adult amblyopia, the results are little slow as compared to in children. So we thought, why not appeal to them? And then COVID happened, so we realized that it has to be like work from home or study from home made came in. So we thought, why not therapy at home mode should be there. So that's how the first version was created. Then it was only in the testing phase, but we got positive responses from our first patient. So then second version was developed with under guidance of Dr. Swati from AIMS, and she's HOT currently, and Dr. Digvijay from Noble Eye Care. So then and now again getting the feedback from the our patients who are little kids. We have actionified the and modified our therapy into more like game like, because when we were giving the therapy we did not think of as it as a game. We just wanted to make it interesting, but now we realize they are asking for more games and more action packed. And so we are working, and we have already developed many such adaptation of the therapies, and few sciences as well has been added. So we will be hopefully launching it on National Ophthalmic Conference, which is due in March, and you will see another version. So what we are doing, CureSee is doing, is working on R&D. In fact, 65% of my strength is in R&D right now, so that we keep finding the latest sciences and which have been proven recently in FDA journals, and how it can be adapted into a digital form so that it can be served over the cloud.
Correct. Yeah, that's great. Lovely to see those success stories actually. Vision got improved from 636 to 69 and 66. So, it was very nice. I would like to,
Yes,
yeah, sorry. Yeah,
uh, yeah, because I'm seeing the results. Why QC is getting results? Because it is not working on a single science which was proven, like contrast threshold. So what we are doing, we are making a we're picking each and every science which has been testified and then adapting it into a digital form, and we are working 360 degrees. Instead of working on one science, what we want is, if it has proven or it has shown in result that it gives some stimulus, like Gaber patches, we do get asked a lot about that, what is this and
right,
why was it introduced. So the reason was there were sciences, and it confirmed it is a patent technology by the Dr. Gaber himself, who found this patents and made it public, and it is in open domain, anybody can use it. But what are is to keep us curiously updated with the latest tech coming in, how to adapt it. And also we are working on a hybrid mode where what I this is my personal belief, that vision therapy, which is through software, is great, but if it is backed by patching and traditional vision therapy, can do wonders. My point is, like, if we have to if we say, when we put a patient to an amblyopia journey, so we're saying 3 months you will get this much correction, with 3 months you will get 6 months this much correction. What we want to reduce that time, so that patient does not have to use my software for that long.
So
right.
And my
even
servers will also be free.
Yeah,
So even if we go through the PEDIC study, it was seen that both combination of monocular and binocular therapy it will reduce the total time duration of the therapy that it needs to be performed as compared to patching alone or dichoptic. So again, when we are giving a complete 360-degree module to the patient, again, because after some point of time, it is not like if we are giving specific games for 6 months or more than 6 months, a kid might get bored over a period of time. So with all these modules combined, we can reduce the duration so that adherence to the therapy or interest in the therapy stays, it does not cross that saturation point for any patient.
right. Thanks a lot. Actually, I was fortunate enough to be in the study when I was doing my master's at UNSW. I did take part in the research by Dr. Seekhu, where we used these Gable patches for the study. But that time we did it in normal patients, but now it already in the amyloid patients, we can use them. So I felt little nostalgic to see those Gable patches because I did spend a whole year on that study. So thank you so much. I would just like to add one more question for both of you, actually. Integrating, nowadays everyone is talking about AI and telemedicine. So integrating telemedicine and AI into optometry education policy, for eye care involves a lot of upgrades and, to ensure that students are equipped with necessary skills and knowledge to leverage these technologies effectively. So, what is your suggestion about this concern?
Ma'am, at one time, for optometrists specifically, they were using retinoscopes. And now I guess not many people are using it. We are using autorefractors, and which are basically point and shoot. So the technology eventually in every space, if it's making our life easy, will be adapted. It is tend to happen. Now talking about AI, it is a very broader perspective to talk about AI inspect, because it is still being discovered that what Internet of Things is, how things will react. So I'll just keep it limit to optometry. Again, the same principle. If technology is helping us out, so there is no harm, because technology cannot take out, might be able to do the correction and everything, or through the various channels that will be available, but it cannot give the human touch to a patient who's saying that I am able to see, but I can my there are two A's and they are overlapping. So that human touch, I don't think AI will be able to. But for rest of the things, like in I think even autoref is an AI, because it tells us start from -3 at cylinder at this degrees.
Right.
Otherwise, you must have had hands-on experience that retinoscope, how efficiently they were using it, and now it has become totally obsolete. So till the time it is not putting the drop in my eye, I'm okay with AI. Till the time it is suggesting, so suggesting which medicine to put and help and saving the chair time, I think it will be needy, and specifically in India, because abroad, optometrists who are having private practices, or even ophthalms, they have fixed number of patients that they will see on a particular day. And that is the reason, when you ask any Canadian that you want to go for an eye test, what date are you getting? So he'll probably tell you, 2 to 3 months down the line. And here, I think you just need to walk to the nearby shop. So what I meant was, since we have large number of population to cater to, and right now we have less number of ophthalms, doctors, in, if I say overall, though it is being worked out, but anyhow, the way our population is growing, there will always be a less of, doctors to patient ratio will be different in India. So if they are helped by AI, or, in assistance, like we are working on something with the government of India, where, it will be able to, with the condition of the patient, will be able to prompt, pre-type the medicines and give alternative, and which will be linked to the pharmacy, and it will tell you that if this drop is available or not. If it's not, then it will not come on on the prescription. So we're calling it smart prescriptions.
Right,
but
right.
but they so in that cases, I think the chair time of a doctor can be reduced, and he's able to see more patients and more effectively, and so I think it is I think it will be beneficial only.
Right. Thank you so much. Do we have any questions from the audience? I think most of them have already answered. Okay, no questions. Thank you so much, Zeba, for giving your valuable time, and thank you so much, Mr. Amit, for
Thank,
being here
thank you,
for the
thank you,
discussion.
ma'am.
Yeah, we loved it, and all the best for your venture. Thank you so much.
Thank you.